Hello.
Hello. As you are aware, deaf-blind, and hard-of-hearing people face many barriers in accessing healthcare, including when we're in the hospital, visiting our doctors or dentists, when interacting with mental health clinicians, and so forth.
We are too often frustrated with the lack of accessibility and accommodations, like scheduling an appointment with your healthcare provider and discovering when you arrive that they didn't even book an interpreter.
Or when the healthcare provider uses a video remote interpreter instead of working with an interpreter on site, one technical glitch after another. Been there.
Or getting to your dentist appointment only to discover they refuse to provide a certified deaf interpreter. How do they expect you to communicate?
Some deaf people are resistant to filing complaints for many reasons. But don't worry, we're here to help you get through this process. It's not as hard as you may think.
If you get bad service when you visit the hospital, you shouldn't write it off as a fluke. Speak up. It's critical you give feedback about the situation to make sure it doesn't happen again. You should never feel mistreated, especially in the healthcare system.
Look at it this way. You're the customer, and the medical offices you visit are businesses that want to provide good customer service. They don't want a bad reputation and rely on your satisfaction and trust. The customer always knows best.
Think of it like you're a customer at a restaurant.
Ooh, I love this place. I'm so excited.
For you, Signora.
Thank you.
Buon appetito! How was your pasta, Signora?
It's cold.
Oh my goodness, I am so sorry. I'll be right back.
Okay.
For you, Signora. Please enjoy.
Oh, yes, much better.
Excelente!
Oh, delicioso.
Buon appetito! Medical offices are businesses, just like restaurants or other places you may visit. As a patient, you are paying for treatment via insurance, and you have the right to receive quality health services.
If something goes awry and you don't speak up, the healthcare administrators will be none the wiser. They'll just go on thinking their organization is running like a well-oiled machine.
There are several laws to protect your rights as a deaf-blind, or hard-of-hearing person. These laws guarantee full and effective communication access to you when you seek services from any healthcare facility.
If you didn't have effective communication access, or if your rights were violated, here's what you can do.
If a situation like that happens, it's important you document these 7 details thoroughly and immediately. You can do this in writing or on video. Check it out. It's easy.
What happened? When did it happen? Where did it happen? Who was involved? Why was this not okay? How have you tried to improve the situation so far? What do you expect to happen from filing a complaint?
See? That wasn't so hard, was it? We know that it may not be easy to go through this process alone. It's recommended you seek out personal and/or professional support while filing a complaint.
Now that you have someone to support you through the process, here's what to do after you answer those 7 questions.
First, research where to file your complaint. The outcome you want to achieve will determine where you send your complaint. For example, you could file it with the clinic administrator, the Department of Public Health, or other governing bodies.
Next, using your answers to the 7 previous questions, write your complaint making sure you include all relevant information. You can ask someone to help translate your filmed ASL descriptions into a written document.
You will need to file your complaint as soon as possible, because some places may not accept complaints if it's past 90 days after the incident.
Start by filing your complaint with the appropriate person and entity.
If you don't get a response within 3 to 5 business days, follow up with them. If you still have not received any acknowledgement, then you have several options. You could take your complaint to a supervisor or to a different agency and/or seek legal counsel.
We hope you now feel more confident standing up for your rights by filing complaints. Please feel free to contact MCDHH or other state advocacy organizations for guidance and help.
If you file a complaint, you will not only be helping yourself and your situation, but other deaf, deafblind, and hard of hearing patients in the future.
If you're ever in doubt, think back to the restaurant example. Would you eat a plate full of cold spaghetti? Of course not. So why accept subpar medical treatment?
Everyone deserves equal treatment. You can do it.
You got this.